Good afternoon. This is our 4 p.m. update on Kentucky's response to the coronavirus. We've been doing these at 9 and 5 on the weekdays and 4 p.m. on the weekends. Let me start the way we always start. We are going to make it through this. I know every day the news out there sometimes can make you anxious, sometimes can seem a little scary. But we are going to be okay. We have to stay calm. We have to understand that we're all going to have to change our lifestyles in different fundamental ways, and we got to be a good part of Team Kentucky. If we are going to change the curve in what we expect of these cases, if we are going to protect our loved ones that are out there, we have to be willing to change our practices, and everybody has to be a good teammate. Couple of places that while we have seen some really good response out of Kentuckians, have to be better. Number one, when we make a run on supplies and you buy an 8-month supply of something, that means other people who need it aren't able to get it. That is not being a good teammate. Fear can cause so much more harm than this virus ever will. Remember, there's 4.5 million Kentuckians out there, and we want everybody to be safe as they get through this. So remember, when you were there at that store, I know you're nervous. I know you're seeing other people getting a lot. Be responsible. Be responsible. Second, this weekend, we saw in some instances hundreds of people going into one bar or one club. We are asking people to make major sacrifices in this state. We're shutting down schools for at least a couple of weeks. We have to make sure that these efforts work. And if you go out and get in a small place with 100+ people, you frustrate those efforts. James, can you put up the graph, the line graph? All right, this is what we're talking about each and every time, trying to reduce the contacts, trying to make sure we create the social distance so we can better protect people. What you see in the blue is what happens if we do business as usual. If people just shrug this off and say, well, they might be doing social distancing, they might be canceling schools, but I'm going to do whatever I want and go out in a large crowd. If we do that, that's what we get in the blue. Folks, we got to make sure that we are all doing our part to make sure that we create one of the other parts of this line graph, that we reduce what would be the impact on our healthcare facilities, which means everybody who needs help can get help. Ohio just issued an order closing their restaurants and bars. And if we cannot show responsible practices in how we social distance, then I will be forced to do the same. We're not there yet, but hundreds of people in a small room does not reduce the contacts that we have to better protect our people. So I'm just asking everybody to be a good neighbor. We can and we will get through this, but it takes everybody. Some good news, though I had hoped at this point we would have all 16 members of the Grand Princess on a motor coach coming back to Kentucky. We have 14 of them. The other 2 are on an airplane to get to the same facility that the motor coach just left for. We're going to go and we're going to get them tomorrow. It left a lot later than we wanted it to. We thought we could get all 16 people together for those 14 that have been sitting around waiting for it all day. I'm sorry for the delay, but we are really excited to get you home tonight. Again, these are our people. I don't think that they've been treated the way they should. We will take responsibility for them here in Kentucky. I know a piece of news just came out, and I want to reassure Kentuckians on this, that there's been an individual tested positive in Louisville that was at a large event that I was also at. I was, because of the directive from our public health commissioner, and his terms being mission critical on this response, tested negative yesterday. So I will still be here each and every day, making sure that I do what I need to do to help get us through this. Now, people we know are going to test positive, and that's okay. We just have to take the right steps to make sure that they are okay. And they're going to continue to work and do other things through this. And I'm going to be prepared if the case arises to do that as well. It'll look a little different than it looks right now, but my promise to Kentuckians is we will work through this. We will work through it together. And we're going to make sure that everybody, and including those that end up having the coronavirus, everybody that we will get through this, and let's get everybody out on the other end healthy. Our update tonight is we believe, as we sit here tonight, we have 20 total positive cases. That would be 2 additional from the update we did online last night. I believe they are 5 from Fayette, 6 from Harrison, 5 from Jefferson, and then 1 from Bourbon, Montgomery, Nelson, and Clark. I'll just read through the entire list. A 66-year-old male from Bourbon, a 40-year-old female from Fayette, a 46-year-old male from Fayette, a 31-year-old female from Fayette, a 47-year-old male from Fayette, a 31-year-old male from Fayette, a 27-year-old female, 67-year-old female, 68-year-old male, 54-year-old female, 60-year-old male, and 51-year-old male, all from Harrison County. And then the Jefferson counties are a 69-year-old male, a 67-year-old female, a 68-year-old female, an 80-year-old female, and a 73-year-old female. Montgomery County is a 56-year-old male. Nelson is a 53-year-old male. And Clark County is a 49-year-old male. We still have one individual who is in bad shape. Right now, we do not expect that individual to recover. The coronavirus is not the only factor in that individual's condition. It is certainly a contributing factor. Our prayers are with that individual's family. I want to go over steps that we have taken to date. Declared a state of emergency to give ourselves the tools that we need to address this coronavirus. We activated the Emergency Management Operations Center and the State Health Operations Center. That lets us communicate with 2 very important different groups. We announced Kentucky's COVID hotline, 1-800-722-5725. That's the coronavirus hotline, 1-800-722-5725. We're getting about 2,000 calls a day on there. We want people to call that number. What it is for is to make sure that we don't flood our healthcare system. That means those who need help the most can get it. So if you'll show the infographic, James. It's very important for folks out there, and we're all nervous. This is something very new to all of us. But again, we only get through it together and by all of us being good neighbors. So the infographic on when to seek care, it's important to follow. If you are well, but you're nervous, I understand. Call the hotline. Don't overwhelm our system. Make sure you're not taking away resources from those that need it and need it immediately. If you are sick but otherwise would not have sought care, again, think allergies, think a cold, call the hotline. Do not overwhelm our healthcare system. But if you are truly sick and would have sought care, or you are injured, get the care that you need. Those are just a couple of basic rules that will help us make sure that we can help those who need it. We issued an executive order to prohibit price gouging. If you see it, call 1-888-432-9257. In the cell phone age, you don't have to put in the 1. So let me read it again. 888-432-9257. We have adjusted state government sick leave policy to ensure we have paid sick leave and the amount people need it, and we want to make sure that businesses are doing the same. We are publishing and continue to publish all the CDC guidelines. I just remind you that they point out those most at risk. Those are people over 60, and if you're over 60, please believe it. Please believe it. I know that 60 we believe that 60 is still young, but the CDC says that those over 60 should have additional significant concerns, as well as those with heart, lung, kidney disease. Think about diabetics, which we have hundreds of thousands of in Kentucky. For those vulnerable populations, do not fly and do not get on a cruise ship. We're recommending social distancing, not just for the high risk, but now for everybody. Again, if we want to make sure that we do this right and that we protect our people, it requires that everybody stay home as much as possible. That doesn't mean you have to be in your home, but it means you are not out in crowds, and that you stay in public 6 feet away from others and wash your hands often. James, can you show our new graph? I want to give you an idea of this was in the Washington Post today, what we believe taking these strong steps can do and why it is so necessary. For those that can see it, the Washington Post ran a chart showing the Spanish flu in, I guess, 1918 to 1919. And it shows two different cities, Philadelphia and St. Louis. In Philadelphia, they started their aggressive steps a couple weeks too late. Shows you what taking these steps and taking them early can do. And what you see is not just a spike in cases, but a spike in deaths. St. Louis took their steps much more quickly after the first several diagnosed cases, and what you saw was an ability to protect the most vulnerable and the loved ones in that city to a much, much, much greater degree. So we don't put this up to scare people. Our healthcare system is much better in 2020 than it was in 1918 and 1919. But this shows the importance of taking aggressive steps. For those that say, but you only have 20 positive cases, as we see the direction that this can go, I'm not going to be the governor that acted 2 weeks too late. This is about protecting each and every one of us. We have had calls with all 120 county judges to update them, make sure their emergency management network is up and running. We initiated changes to Medicaid and signed an executive order with regards to private insurance to work to eliminate any costs associated with treating the coronavirus and with testing. We hope that we will see widespread testing sometime in the future. Our mission right now is to deal with the reality that is on the ground. We have recommended eliminating visitation in long-term care facilities and nursing homes, except in end-of-life situations. We signed an executive order to allow pharmacists to refill prescriptions up to 30 days and to stage pharmacies if we need to outside of the pharmacy. We asked all our school systems to cease in-person classes beginning on Monday, and every public school system has agreed. As a new piece of news tonight, I don't have the exact number, but I believe we are getting close to having all of our systems approved to provide types of learning remotely should they opt to do so. And keeping our kids engaged during this, as you saw yesterday with Dr. Brenzel talking about it, is really important. Keep them on a schedule. And make sure that you're communicating in appropriate ways with them. I have 2 young kids. They're also nervous about this. I understand the anxiety that goes along with that. We've closed our prisons to visitors, and we've advised that all community gatherings should be canceled or postponed. Again, if you're putting together a large group of people for a community gathering, you are making it more difficult for us to reduce the contacts that are out there and to get the result we so desperately want for the most vulnerable. We suspended out-of-state travel for state employees. We're encouraging all businesses to allow employees to work from home if possible. We have recommended the temporary closure of senior centers. That is a difficult step, and we understand that. We are working with local communities to ensure that meals can still be delivered. But when we think about the most vulnerable congregating in one place, it presents an opportunity for that virus to spread. We announced that KEMI, Kentucky Employers Mutual Insurance, will provide wage replacement and benefits for first responders and medical personnel who've been quarantined for the coronavirus. They are our frontline workers. We got to be there for them. We announced boards and commissions are going to cancel in-person meetings, instead use video teleconference technology. There's going to be a link where the public can watch all of that. We followed the emergency declaration from the Federal Motor Carrier Safety Administration, which provides regulatory relief from commercial drivers who are providing direct assistance in the coronavirus relief efforts. The USDA approved our waiver to be able to serve meals to students during non-traditional instruction, and that is the other approval I was talking about was for most all districts to be able to do non-traditional instruction. For those watching, we have so many acronyms in state government. This one is called NTI. Also issued guidance to state agencies to decrease on-site staffing by at least 50%. That is our initial goal. We've got some big office buildings here in Frankfort. We are going to be looking at ways to where everything the public needs that can be done remotely to be done remotely. And every day, we're going to continue to look at different ways that we can reduce those contacts. We want to model behavior that we want to see out of businesses, and every day people should think through what they do and how they do it and how we can, again, reduce those contacts and better protect people. We asked Kentucky hospitals we asked Kentucky hospitals to cease elective procedures by the close of business Wednesday, March 18th. We are having ongoing conversations with them about what is or is not an elective surgery, but let me be clear about this. We absolutely must be ready if we see a significant influx of cases, which means we have to take the steps to be prepared for those cases. Again, I'm going to be the governor that takes that aggressive step to make sure that if we see a spike, then we have done the steps we need to have that additional capacity to see those that need it. I know the people most likely to be affected in that are going to be our parents and our grandparents, and I want them to be around for years to come to be with my kids and everybody else's kids and grandkids. We are working to make sure that COVID-19 testing will be free to all Kentuckians, even if they are uninsured. We're asking child care centers in Kentucky to create plans for closure that they could implement within 72 hours if it is deemed necessary. One area where we are going to have to make exemptions, and we're working through it, is for our health care workers. With what we have to be prepared for, we're going to need to make sure that our hospitals and our other healthcare facilities have those workers that are there. We've taken steps, and we took the step which we hoped we wouldn't have to. The first time that we've had to force a home isolation when a coronavirus patient initially refused to self-quarantine. My understanding is that they are making a number of calls to the media and to others right now. This is a really irresponsible decision. This person tested positive to the coronavirus. All we asked is that they self-isolate. They can do it in their home. They can be comfortable. All we're asking them to do is not to spread the disease that's out there. And because they refused, we had to take those steps, and we will do it again if we have to ensure that we can protect the public. I know that individual probably isn't happy, but they are in their own home. And I hope that attitudes can improve and that this is the only time that we have to do that. Finally, we have now issued tips and guidance to help support good mental health and relieve anxiety during this period of time. I want to focus on this for just a minute, and then we'll open up to questions. We know that we'll get through this. We don't know exactly how long it's going to take. We know that when you reduce social contacts, and remember, social distancing is not isolation, and it shouldn't be isolation. If you do not have the coronavirus, we want to make sure that you do have human interaction, but you have to have it in the right confines, and we have to be able to reduce overall contacts. Mental health is going to be critically important getting through this. Make sure that you do things that help your mental health. So today, I think I took the dog on about 14 walks. She's a puppy. She needed about 5 of them, but she got a lot more. My 13-year-old dog went on about half of them. That's about all she can take. I had to carry her up the stairs by the end. You know what? Those walks were better for me and for my family that went with me than they were for the dogs. I threw baseball with my son. Or he threw to me because he's got a finger right now to where he can't catch. We set up a bucket of balls and we let him throw. Those are all things that we can do as a family that help in this time. We talk about this. We don't talk about it all day long, but we talk about it, and that's critically important too. And let me ask everybody: you do have to shut off all of the information that is coming in at least some of the day. I know there are networks that would like you to watch all day long, but it is not good for your mental health. Let me remind people that 80% of people that get this virus, you're going to be okay. You're going to show little to no symptoms. The reason we're having to take all of these steps is to protect the most vulnerable. So let's remember our 2 duties. Number 1, you do everything you can, practicing all that good hygiene to make sure that you do not get the coronavirus. And number 2, you prevent from spreading it to others. So if you want to get energy out, get outside, go for a run on your own. Do not pack in to one place thinking that this is not a big deal. Yeah, what you're doing probably won't hurt you, but it could really hurt somebody else. That could be somebody's parents. That could be somebody's grandparents. I'm just asking you to do the right thing. All right. With that, I'll open it up to questions. I have both written questions and people who are here. Once again, I do have one reporter that has both written questions and is here. Morgan, you win that one again. All right, let's start with Chris.
What exactly were you briefed on in Nelson County? I'm curious as to what the information was that you were given about this family. The family says that the communication was murky late on a Friday night, and they contend that maybe they weren't communicated with in a way that made things clear to them on Friday night. What did you know? What were you told?
Most of the information related to that case is currently under seal, but what I was told is that we had a patient that has tested positive for the coronavirus and has refused to self-isolate.
Do you know if health departments are taking a concern, if there's a protocol set in place to make sure when they communicate with people, if they've been released from the hospital before they've tested, that it is abundantly clear?
Let me say, while I was not there when someone was released from the hospital, but somebody being released from the hospital that still has the coronavirus, that has not had the negative test yet, absolutely knows that they need to self-isolate. And I don't want to get in a back and forth. I'm not going to identify the individual, but everybody has a responsibility in this. And our hope is this is the only time we have to take these steps. Tom.
First thing, Governor, the 2 new cases, I know Clark County
is one.
I've not heard that before. Where was the other one?
I believe when I look at the numbers, if it's Jefferson. I believe that's the case because I believe the last 2 last night brought Fayette County to 5. Is that everybody else's understanding? Again, 1 in Jefferson, we only have a verbal confirmation on. I do not believe it is a duplicate now, but we haven't been able to confirm that in our lab. So we're going ahead and we're saying that we have 20. I believe we are more likely to have 20 than we thought with our numbers yesterday on their accuracy. But remember, we now have 3 labs, and I hope we'll have more. And we get the information in different ways. So what I'm going to try to provide each day is the absolute best numbers that I can. I believe we have still at our state lab for tonight 19 additional steps. Now, as we move forward and more labs come online with more capacity, which is what we want, our state lab won't be the driving lab. The state will more be the clearinghouse where that information comes in, and it'll be coming in from a lot of different areas. Morgan.
You said that you took a test for the coronavirus yesterday and tested negative. Can you clarify what was the event that you were at, the speedball at the Speed Art Museum?
Yes.
Plants like Toyota, do you think it's a good idea that they temporarily close? I mean, there's tons of workers at places like that.
We right now are asking businesses to do everything they can to stop the virus within their workplace. And what that means is where it is possible, social distancing, where anyone can work remotely, they ought to be, to look at your surroundings, to encourage, and when you can, in a workforce, force good hygiene. That's just saying if you can add extra breaks, stagger them where people wash their hands and engage in good hygiene, they should. We also have to make sure that if you're sick, you don't go to work. And I used to say if your kids are sick, don't go to school. Well, now we're not having school at least for the next couple weeks. Tom.
Anything new, have you heard from the General Assembly on whether they still plan to come back Tuesday? Do you have any arrangements to, perhaps you're working with legislative leaders to speed up the process, maybe pass a quick continuation budget, go home, and then come back later?
So the question, I remember I'm supposed to repeat the questions, is if I've talked to the leaders of the General Assembly and have any update on what they might do in the session. There were more parts to the question than that, but I have not talked to them since we talked yesterday. I do have a text from one of those leaders, and we'll talk to them tonight. Where we see this is going, and where where we could anticipate having the surge that we've got to be ready for in our healthcare facilities, I believe that it is increasingly clear that they need to do the most important work, do it in as short order as possible, and then go home. We cannot right now guarantee how long that this will take. We cannot say for certain that we would be able to have them back in enough time to pass a budget. And what we see is the dollars are so critical when it comes to this. And what we need is a budget for right now. And so we're all in uncharted territory here with the impacts that this is having on the economy and to everybody's personal finances. And we're going to get through it. We are going to make sure that we protect all of our fellow Kentuckians, and then we're going to have to get to the work of restarting, and in some instances there will be some rebuilding. But we've done it before, and I know we can do it again. Yes, ma'am.
In the instance with the Nelson County person, if they do try to leave again from isolation, what are the repercussions of that?
My understanding is that there is a sheriff's deputy outside. Again, these are resources we shouldn't have to expend, and we hope everybody will do this voluntarily in the future.
Would there be force, though, as far as whether it be tackling, tasing?
Well, we haven't hit that point, and even with what I hear is the individual disagreeing, I don't think anybody thinks it's going to get to that point. Let me read a couple questions, if I can. We have a question on concerns about food shortages in grocery stores. We are starting to look into this. I'm working on creating a call with CEOs or operators of our major stores tomorrow. We just need Kentuckians to be good neighbors and realize that if you take 8 months of baby formula, it means another mom won't be able to get it. We ran into that issue yesterday. We were able to find people who had some at home, but we take care of each other in this state. And let's remember, through our fear and through our nervousness, that we have to do that. But we do need to have conversations with the food industry and just make sure we have the right practices in place to where that supply chain can continue as we are moving. There's a question on the Red Mile being open for slots and betting parlors and tracks. I believe that you will hear some news from those organizations perhaps tonight, if at the latest, early tomorrow. Now, there's a question here about the two individuals who were at a separate Air Force base. The 14 were at Dobbins. These two were at Lockland. We were able to finally get them on a plane today to get to Dobbins, but there was so much of a delay. We had to go ahead and take the 14 at Dobbins. Otherwise, they weren't going to get home today. We're going back for them tomorrow. Again, it's taken too long. There have been frustrations at every step, but I will tell you this is happening because I absolutely demanded it, and our Commissioner of Public Health has demanded it. These are our people. We want them back home. They have been through too much. Let's take some more in person, and then I'll get to some of the other written. Yes?
Those that attended the speedball gala, have they been advised of potential exposure?
I believe that the health department there in Louisville is taking steps. I believe that there are some folks that have already been called and that those calls are coming. That's the information I have at the time. Al?
Any feedback from churches today? There was a report in Hopkinsville that very few were cooperating with your call.
The question is, has there been any response from churches today? My church did a virtual service, and I appreciate them for doing it. As I look at the congregation in my church, it is at least a third filled with the most vulnerable for this virus. There has been at least talk in Montgomery County about potential spread through a church there, and we have a direct link between two of the Harrison County individuals that is their church. Again, I don't think having church or going to church during this is a test of faith. I believe God gives us wisdom and has given us so many tools to be able to participate in worship remotely or through other areas. I know that there are people that might politicize this. And every time I talk about my faith, I hear that. But I love my church. It's an important part of my life. My faith is an important driver in helping me make the decisions that I'm making during this crisis. We just need everybody's help. We don't need people to be exposed to the coronavirus that might not be able to recover. And so I would hope that going forward, everybody thinks through it and hopefully makes good decisions moving forward. And it's, again, I've heard that churches are being singled out. You're not. Houses of worship aren't just being singled out. We are trying to get every community gathering to be canceled for in-person attendance and instead to be done remotely. We're asking that of everything. Morgan, and then Chris, and then.
Who decides if, for the U of L and LabCorp labs, who decides whether or not a request for a patient to get a test actually gets conducted? Is that up to the state health department to clear those, or is that up to U of L and LabCorp themselves?
That doesn't come through the state.
No, they just send it.
Yep.
Take the specimen and send it. And then
So the question was, who decides with the other labs whether or not a test is run? Dr. Stack is here in the audience. Again, we're trying to practice good social distancing. His response is it is up to that clinician that is working with them, hopefully following those CDC guidelines. But I will tell you that each of those groups is also facing the same resources that we see on the ground here. We all want to get to a point where everybody who wants a test can get a test. And I will tell you that when that day comes, and it will, we will ensure that we have a manner to do that widespread testing. We are already making those plans. We're going to be ready. I wish this would happen tomorrow. It's not going to happen tomorrow. We keep getting different timetables, and they keep changing. But what I know is we have to plan for what we see on the ground right now. Chris.
What will the protocol be for the people coming back from the cruise when they get to Kentucky? Will they be able to go home? Will they be isolated? What's the protocol?
They are going to self-isolate, and I believe they are just self-isolation.
yes, and
Yep.
the clock started when they landed
Yes.
in California.
So they have been self-isolating. The period of, let me start back. The question is for those who are on the cruise ship, what are the next steps being taken? They started self-isolation at the Air Force bases that they were at. That will continue once they get home. Everybody has agreed to do it. Yes?
We've had several viewers canceling trips and things like that for those traveling. How far out, any guidance on how far out they should be canceling things, or any guidance?
Yeah, I wish I could give people any type of certainty about how long it's going to be. We're going to make it through. I know we're going to make it through. And we're going to have to be resilient. because we are looking at more than weeks. But we are going to make it. I would not remake plans yet. And as we move forward, what I hope we see are the steps that we are taking. Means we're more like St. Louis we are more like, let's put it up, more like St. Louis than Philadelphia. And that means if we have impacted the curve, and I know all this sounds very theoretical, impacting the curve means we're protecting people. It means by changing the level of contacts, doing social distancing, canceling all of these events, it means that fewer people are harmed because of it. But don't fly. Don't get on a cruise ship. I saw a story on a national news outlet where a cruise ship company was trying to offer deals. Listen, I know it's going to harm that industry, but to every single Kentuckian that's listening to me, don't get on that boat no matter what they offer you.
Oh, I know yesterday we weren't able to say what county the person was from that is in bad shape.
Yeah.
Are we able to say that now?
Not yet. I believe we'll be able to do that if what we believe is going to happen and that person we ultimately lose. I still want to try to respect their family, especially in what may be the waning hours. Okay, I've got a few more that I want to read, and then we'll just take a couple more. I think I answered one. One is about state buildings here in Frankfort from our Frankfort paper. Under what circumstances would large office buildings such as Mayo Underwood, Transportation Cabinet, and 300 Sauer be closed entirely? We're not there yet. The two things we are trying to do is to decrease with a goal of 50% the numbers of employees that are in the office, and then also decrease any in-person need to visit those offices. And you're going to see we're going to have a number of e-regs, we're going to have a number of changes to make sure people can get documents they need, that get services they need, when right now it might have to be in person. We're going to have to do a lot in this interim legally to make sure they can still get the services that they need. I think we answered the first question about U of L or LabCorp conducting a test for a patient. The answer to the second piece is, does the state health department have to approve? The answer is no on that. And so we hope that our hospitals can get from any source as many tests, as many kits as they can, but they also have to use them responsibly. You know, there have been other locations where they just tested the first people who came in no matter what, and they're out. And now they don't have them for the people that need them the most. So every group that's out there doing this, we're asking to be really responsible. Now, again, we are all in this together, and I would like to think that if we were all at one place together, we would want those that are most hurt or most sick to be in the very front of the line, and that's what we're doing here. Have any doctors or nurses in Kentucky who have treated coronavirus positive patients received a test? I believe that is the case, but I do not believe that we have a positive on any healthcare worker as of this date. Let me say, these people are heroic. Faced with what we're faced with, they are there. They are doing tests. They are treating people. It's really incredible, and we ought to appreciate them. We're going to take the steps to try to protect them as much as we can, but you know what? They're doing it each and every day, and boy, do we need them as we move through this. And then there is a question, has there been any discussion of keeping the Ashland Hospital that's about to close open? We're looking at different scenarios each and every day. That's one we haven't had a discussion about yet. They may have had it locally. There are a couple of questions in Nelson County, but I believe we have answered those. What statute am I using or has been used in the Nelson County incident? There are a number of different statutes that come into play or could come into play. They include KRS 214-020, KRS 39A100, KRS 387-660, KRS Chapter 209. And right now, the documentation regarding that individual is under seal. I get that was done locally there. One question was, anyone infected while the Nelson County individual refused to cooperate? We don't know. but anybody who has tested positive that is not in isolation runs the risk. Remember, though, that just because you've come into contact with someone that has a coronavirus does not mean that you have the coronavirus. If you are using good hygiene, if they are using good hygiene, just like other viruses that are communally spread, you may well not have it. And again, now having lived through this a little bit myself, I know that can be nerve-wracking. 80% of people that are going to get this, you're going to be okay. So if you end up in that situation, you're going to be okay. And understand as you go through that process that we are going to make it out on the other side, and that at the end of the day, we are going to get there, and we are all going to get there together. The most important thing is everybody's got to remain calm. Again, fear runs on grocery stores where you don't have enough for everybody else. Those are the types of things that can harm more people than this virus ever will. I'll take a couple more. Morgan.
How many patients have been denied a test by the state that was requested by the patient's doctor at this point, roughly?
I don't think we have a number on that. All of these decisions are made jointly, and the best decisions are being made for those that need it the most at this time.
Governor, that is really one of the biggest look-backs that's going to be done in this country on this question. And I understand the difficulty in producing a number at this point, but are we going to be able to get a number at some point to that question?
My hope is that in the very near future that we have the lab capacity across this country to where anyone and everybody who wants a test gets a test, and where what we do at the state is to compile the data that comes back. I believe in what we have seen to this point, that our people at the state have done their very best in very trying times with a virus that didn't exist until 3 months ago, or that we didn't know about, and there was no test because it didn't exist. And so, I believe that our healthcare system is responding as well as we can. There's no question that nationally there is not the resources and the testing resources that we need to exist on the ground right now. I'm going to do everything I can to get us there. My job is to deal with the day-to-day at the moment and to protect Kentuckians as best I can.
But once we get through this, are we going to get a number?
Well, I hope that once we get through this, our number that is most important in Kentucky is that we've lost as few people as humanly possible. And Al, my job from now until the end of that is to do that. And then afterwards, people can look at all the data that's out there. They can go over any decisions I've made. I'm going to stand by all of them because there are a lot of people that are vulnerable in this state. And we have some of the highest rated diabetes, of lung cancer, of heart disease. We got a lot of vulnerable people out there, and I want to protect them all. We'll do two last ones.
The governor of Ohio has also said he thinks that schools may need to be prepared to be shut down for the rest of the year, and I was wondering if that's something that's on your radar.
We are not. The question is, the governor of Ohio has said that schools may need to be shut down for the rest of the year. We're not ready to recommend that, but we do think that we at least need to be prepared for longer closures. Yes.
Have you been able to issue a response to the ACLU from roughly about 3 days ago, asking about releasing those who are just awaiting bail or couldn't make bail?
We haven't been able to release a response on that yet. We'll work on that. All right. Thank you all very much. 9 o'clock Monday morning.